And boy, don't we remember lines like this, something we were getting used to seeing around here, even sitting in for many of us as people waited for sometimes hours to get their COVID vaccine. Well, today that once familiar sight returned as Summit County fired up their drive-through vaccine clinic again, but just for today.
So why did they bother when we're seeing such low levels of virus circulating here in Northeast Ohio? Not just here in Northeast Ohio, but really in the United States. Well, for that, we turn to senior health correspondent Monica Robbins. She joins us now to explain. Good afternoon, Monica.
Hi, guys. Yeah, vaccines back in the news, of course. So that always causes an uptick. So since the CDC changed the booster guidelines, Summit County's health commissioner says they've seen an uptick in walk-in appointments. So they decided to do the drive-through because, you know what, it's just more convenient for people. And they're going to do a few more of these in the coming weeks. Now, I know that changing vaccine guidance can be really confusing, but it's important to understand boosters are not uncommon when it comes to vaccines. Both vaccine and natural protection wanes over time. And even though there are fewer cases right now, there is still a mutating virus out there and a vaccine that can protect you from it, especially if you're vulnerable.
Because we now have enough clinical data to know that this group could possibly have their immunity start to drop. And folks say, well, you know, there isn't much COVID around, why should I care? Because you're vulnerable, and that's why you may have a chronic disease, you might be advanced age, you could have some underlying health condition. You need to make sure you protect yourself at all times.
And SCOTUS says those who are vaccinated have a 93% chance to not get severe disease, end up in the hospital, or die. Even for Omicron, that can still infect those who've been vaccinated. The vaccine, remember, is meant to prevent severe disease, not infection. And I think a lot of people still get that confused.
So then who should be getting the boost, the fourth dose?
$1,000,000 question. So vaccine protection, remember, tends to wane. So if you are over 50 and your last booster dose was 4 months ago, and maybe you have a chronic disease, you definitely need to get boosted. 40% of COVID deaths happen to diabetics, and even higher among those with high blood pressure. Now, if you care for a vulnerable person at home, such as maybe elderly parents or babies who can't be vaccinated yet, you should also get boosted. Now, if you're not sure about whether or not you need to do this, talk to your doctor and pay attention to the news, because I'm going to tell you right now, we're going to see some jumps. Sure. Memorial Day, about a week or two after, we're going to see some case jumps. 4th of July, again, it's like clockwork. We can see it coming.
Right.
The hope is, though, as this virus continues to mutate, as I said the other day, with XE, we're hoping that it's not causing severe disease. It may be more transmissible, but if it's not causing severe disease, that's just a good thing for all of us.
Yeah. All right. Very good. Thank you, Monica.
Sure.
Great information.